Hello everybody, this is Dr. Rabia Mustafa Abu Layla, consultant family medicine at American Mission Hospital, Bahrain. I'm so excited today to present to you how long does COVID-19 immunity last? This is a very basic question and it's a very common question from our patients in our clinics. And the answer would be, this is difficult to say definitively. We don't know too much about COVID-19. Why? Because the body immune system responds to an infection, it isn't always clear how long any immunity that develop will persist. And COVID-19 is a very new disease for us, and scientists are still working out precisely how the body fends off the virus. But there is a reason to think that immunity could last for several months or a couple of years at least, given what we know about other viruses and what we have seen so far in terms of antibodies in patients with COVID-19 or on people who have been vaccinated. So based on our previous experience with other viruses and what we're seeing now concurrently with COVID-19 infection or post-vaccination, we assume that the immunity will last for several months or a couple of years. But the exact figure is difficult. Why is difficult? Because the result of immunological studies of COVID-19 vary. And the immunity determined by other factors besides antibodies. We are concentrating on antibodies, but there is other factors like B and T cells, which some studies estimate could last for several years. And immunity is induced differently by natural infection versus vaccination. So all these factors makes us difficult to state the actual time for our immunity against COVID-19. So one cannot just combine the studies to arrive at a definitive figure. But the basic question is, again, how long do antibodies against COVID-19 stay in our body? Now, if we have people got infection, natural infection, we have people got vaccination, how long do antibody against COVID-19 stay in our body? The data indicate that neutralizing antibody lasts for several months in patients with COVID-19, but gently fall in number over time. This is fact. So we have antibodies against COVID-19 either through post-infection, natural infection, or post-vaccination, but it's going down over time. One study published in the journal Immunity mentioned in 2020, around 6,000 people who had recovered from COVID-19 infection found the antibodies were still present in their blood 5 to 7 months after the illness. So this is fact, and this is true for mild and severe cases. So even though patient had mild infection, they got antibodies, but people with severe disease ended up with more antibodies overall. So we know that after infection we are developing antibodies. That's clear. And all vaccines so far produce strong antibody responses, according to literature. This is, again, we have the other arm. So patient who has natural infection, they are getting antibodies, and patient who is getting vaccine, also they are getting antibodies. The study group for Moderna vaccine reported in April 2021 that participant is an ongoing clinical trial had high levels of antibodies 6 months after their second dose. So we have antibodies and persist so far for 6 months. Again, in another study about Oxford AstraZeneca published in Lancet, induced high antibodies with minimal waning for 3 months after a single dose. So again, post-vaccination for other type of vaccine, we are getting immunity, but minimal waning, and this is a fact that we know. Neutralizing antibodies are expected to decline in number over time. This fact, how we know about this, given what we know about immune response for other infections. We know there's the fact that other infections that the antibodies may decline, and could be the case for COVID-19 infection or vaccination. For that, now the discussion is about the booster dose, and this is across all vaccines. It's applied for Pfizer, Moderna, AstraZeneca and Sinopharm, millions of people could offer booster vaccination from September. This is in UK, and the reference from BMG. So for that, the antibody is declining, so we need to get booster dose to optimize the immunity. So this was about the antibodies. What about the other component of the immunity? What about the T cell and B cells? What does COVID-19 infection or the vaccination induce B and T cell memory cell? Let's go back for background. For basic science of immunity, T and B cells have a central role in fighting off the infection and crucially establishing a long-term immunity. So if we are looking for for long-term immunity, we need to check the T and B cell status. Some T and B cells act as memory cells, persisting for years or decades, primed and ready to reignited as a broader immune response should their target pathogen arrive in the body again. It's these cells that make it truly long-term immunity. So we need to look about B and T cells responses. A study published in February in Science journal assessed the proliferation of antibodies as well as T and B cells in 188 people who had COVID-19 infection. Although the antibody is declining over the time, memory T and B cells were present up to 8 months after infection, so it's promising. After infection, we are getting B and T cells. This means that we will get a long-term immunity. Another study in a comparably sized cohort reported similar result in a preprint posted in Med-Treatment in 27 April 2021. So similar. So these two studies saying that we have response at level of T and B cell memory, and which we anticipate long-term immunity against COVID-19. A well-known Nature paper from 2008. Okay, in 2008, there is one paper found that 32 people born in 1915 or earlier still retained some level of immunity against the 1918 flu strain. So basically, these people they had a flu at 1918, the pandemic at that time. Till now, they have the immune response against this flu. This is what I'm trying to say. Presence of B cell and T cells will give immunity long term and for decades. So most probably we have in COVID-19 same case. A paper published in July 2020 in Nature found that 23 patients who had recovered from severe acute respiratory syndrome still possess CD4 and CD8 T cells 17 years after infection with SARS-CoV-1 in 2003 epidemic. So again, this is a case, another virus, SARS-CoV-1. People still they have the CD3, CD4, and CD8. So again, this is indicate that we may have long-term immunity. But again, these are early studies, and we still lack definitive conclusions about the role of T and B cells in COVID-19 immunity. How does natural immunity compare with vaccine-induced immunity? Various studies have shown that an immune response involving memory T and B cells emerges after COVID-19 infection, which indicate that long-term immunity against COVID-19. But people's immune system tend to respond in very different ways to natural infection. However, the immune response after vaccination is much more homogeneous. For that, there is some evidence that vaccination can sharpen the immunity in people who have previously been infected with SARS-CoV-2 and recovered. For that, we have recommendation to take vaccination even after the natural infection. And there's another study published in Lancet. They gave vaccine for those who had previous infection, and they discovered 140-fold 140-fold from the peak of pre-vaccine levels has increased. So basically, yeah, we need to give vaccine for after natural infection to make it homogeneous response. The question is there any difference between vaccine-induced immunity first dose and second dose? It's difficult to get a sense of entire immune response after one dose of vaccine versus two, but multiple studies have investigated antibody level at different stages of dosing. A study from researchers at University College London involving more than 50,000 participants found that 96.4 were antibody positive after 1 month first dose, either Pfizer or AstraZeneca, and 99.1 were antibody positive after between 7 and 14 days after the second dose. So yeah, you may get the response after first dose, but we need the second dose to reach the optimum level of the antibodies. How does immunity affect reinfection? Detected cases of reinfection are rare. Yeah, it's there, but it's rare. People become infected after vaccination or initial natural infection, they will probably experience only mild illness at worst. Will COVID-19 vaccine cover the new version? SARS-CoV-2 is known to mutate relatively slowly, and the early studies have found that there is still good cross-reactivity against the new versions of the virus. Thank you. This is Dr. Rabia Mustafa Abu Layla. Assalamu alaikum.